Hello, my name is Heather Beavers. I am a nurse practitioner student at Texas State University, and today I will be doing the health history and physical exam with my patient, Mr. DW. So I'm going to go ahead and get started. When I enter the room, I'm going to wash my hands and introduce myself. Hello, my name is Heather Beavers. I am a nurse practitioner student at Texas State University, and today I will be doing your health history and physical exam. Is that okay?
Yes, ma'am.
All right, so I'm just going to jot down some of the stuff that you tell me. Is that okay with you?
Yes, ma'am.
All right, so I'm going to get started, and if you could just tell me your name and date of birth.
My name is D. Dub, and I was born May 5th, 1988.
Okay, so what brings you to the clinic today?
Just getting my checkup done. That's pretty much it.
Okay, any other concerns you've been having?
I have been having a headache. It'll last for a couple of days, and it started a couple weeks ago.
Okay, so it started a couple of weeks ago. What do you think caused the headaches?
Possibly just being dehydrated and just sensitive to light.
Okay. How would you rate the pain on a scale of 1 to 10, 10 being the most excruciating pain?
I would say it's around 4.
4? And is that at its worst, a 4?
Yes, ma'am.
Okay. How is the quality? Would you describe it as sharp, dull, aching?
It's dull.
It's dull?
Mm-hmm.
And can you point to where it hurts?
Hurts right here. It gets behind the eyes, and then it will travel to the back of my head.
So it does travel. Does it ever go to the left side, or it mainly stays on the right?
It mainly stays on the right, but every now and again it'll be on the left side as well.
Okay. And are you feeling any other symptoms like nausea or vomiting? Maybe ringing in the ears or neck stiffness?
No, ma'am.
Okay. What helps your pain? What makes it lessen?
Mostly one Tylenol pill will keep it all right, but for the most part, I do like to lay down with a cold towel just around my eyes.
Oh, okay. And have you noticed anything that may make the pain worse?
Just the light.
The light. All right. So now, these headaches, how long do they typically last?
They typically last for a few hours on and on for a few days, and then I won't have any for the rest of the week.
Does it happen at a certain time of day?
Mainly during lunch, a little after lunch.
And I know you mentioned that you think that it could be due to dehydration. Do you feel like you're not drinking enough?
I mean, at most I have just a couple of bottles of water.
Oh, okay. All right, maybe we could work on getting you to increase that.
Yes, ma'am.
All right. So now I would just want to ask about your past medical history. I want to concentrate on your childhood illnesses. Have you been diagnosed or been hospitalized as a child?
No, ma'am.
All right. No measles, mumps?
No, ma'am. I did have the chicken pox at age 9. Other than that, and the chicken pox itself, it wasn't anything abnormal about it. It was just pretty plain and dry.
No complications?
No, ma'am.
All right. What about your adult life? Any diseases or illnesses?
No, ma'am.
No high blood pressure, cholesterol issues, diabetes?
No, ma'am.
All right. And what about any prior injuries or hospitalizations, surgeries in general?
None.
All right. What about your vaccinations? I know we're getting geared up for flu season this year. When was your last flu vaccine?
I would say last year around October.
October? And are you current on your other vaccinations?
Yes, ma'am.
Do you know when you were last vaccinated for tetanus?
Possibly a year ago as well.
1 year ago? And what about hepatitis?
That's about 3 to 4 years ago.
Okay. Do you currently take any medications?
No, ma'am.
Okay. I know that earlier you mentioned that you do take Tylenol, so we want to include any over-the-counter medications as well.
Other than Tylenol, that's it.
Okay. And you said that you take 500 milligrams, about 1 tab for pain.
Yes, ma'am.
Any allergies to medications?
No, ma'am.
What about any food allergies?
No, ma'am.
All right. So now I just want to ask about your family. We really want to concentrate on your immediate family, your parents, siblings, children, or grandparents. Any diseases that tend to run in the family?
Not from what I'm aware of. No, ma'am.
So everyone's pretty healthy?
Yes, ma'am.
All right. Now your parents, are they still living?
Yes, ma'am.
And how old are they?
My mom is around 60 to 61, and my dad's around 65 to 66.
Okay. And let's talk about your dad's parents. Are they still living?
My grandma, or his mom, is.
Okay. And how old is she?
She is around 97.
97. All right. Awesome. Any health issues with her?
No, she's pretty healthy for being 97.
Oh, very good. What about your granddad on your father's side?
He passed away.
Do you know what he passed away with?
Old age.
Old age. Okay, what about your mother's side? Let's talk about her parents.
Unfortunately, I didn't really get to meet them. They passed away before I was born.
Okay. Do you know what they passed away with, or?
From what I'm aware of, just old age.
Do you know the ages that they died?
I believe they were both in their 60s to early 70s when they passed away.
Okay. And do you have any siblings?
I have an older sister.
Okay.
And I have an older brother, but he passed away.
At what age?
He passed away at age 29, and that was from a car accident, no disease-related incident.
Okay, well, I'm really sorry to hear that.
Mm-hmm.
What about your sister? Any diseases that you're aware of?
No, she's perfectly healthy.
And how old is she?
She is 7 years older than me, which makes her 36.
Okay, perfect. All right, now I just want to get into your health practices. I know that you said you're from Austin in your little questionnaire earlier. Are you originally from Austin?
I was born in Corpus Christi.
Okay, so what made you move to Austin?
Job.
And what do you do?
I make video games.
Oh, okay. And are you working full-time or part-time?
I'm working full-time.
And what kind of job is it? Are you sitting down? Are you walking?
It's an office environment, so I'm mainly sitting down staring at a computer monitor for hours.
Oh, okay. Do you think that might have an effect on your headache?
More than likely, yes, it does.
All right. So you moved here with Austin. To Austin. Did you move with anybody?
My wife.
Your wife? How long have you been married?
About 7 to 8 years.
Oh, congratulations.
Thank you.
All right. Did you move into a house or an apartment?
Oh, one-bedroom apartment.
One-bedroom apartment. And what is your highest level of education?
I got my high school diploma, but I do have a couple of years of college education underneath my belt.
Okay, very good, very good. All right, do you have any stresses right now, any main stressors in your life?
Other than work on trying to meet deadlines, no.
And how do you relieve your stress?
Typically just play video games.
Oh, well, that's awesome that you could play video games as fun or for fun and then do it as a job. That's really cool. All right. I want to talk about your environment. You live in a one-bedroom apartment. How far away do you live from a main grocery or food source?
A few miles away.
A few miles? What about a major hospital or a hospital?
Same, a few miles away.
Okay, so not too far. What hospital do you mainly go to?
St. David's.
St. David's? Okay. And do you smoke?
No, I don't.
Okay. And how much do you drink?
Um, Maybe a couple weekends out of the month, and that's only socially. And even when I do drink, it's typically a few beers.
Okay, a few beers at a time. And that's out of the month, a few weekends. Would you say that you need to cut back?
No.
Okay. What about caffeinated beverages like coffee or energy drinks?
Almost every morning for coffee and energy drinks. It's every morning to every other morning.
Do you drink coffee and energy drinks?
No, it's either one or the other.
Okay, but it's every day.
Yes.
All right. All right. Do you eat out often?
Yes.
How often would you say you eat out?
About 3 to 4 nights out of the week.
Okay. Do you have any home cooked meals at home?
Yes.
And what's on the plate usually?
It's usually either chicken or fish with vegetables, and the vegetables vary.
Okay. Do you work out?
Yes. Not as much as I should, but I do work out.
How often would you say you work out?
I work out maybe 2 to 3 times out of the week, and doing 30 to 45 minutes for each session.
Okay. And do you mainly do strength or cardio?
One week I'll do 2 days strength, and the middle day cardio, and then just switch it the next week.
Okay. All right. Good. What about any drug use or substance abuse?
Nope.
Okay. Have you had a physical exam before?
Nope.
No? So this will be your first?
Yes, ma'am.
All right. So now I just want to ask about your sexual activity. Are you currently sexually active?
Yes, ma'am.
All right. Are you using any protection method?
Yes, ma'am. We use condoms.
Okay. Have you ever been tested for a STD or had an infection in the past?
No, ma'am.
All right. Do you have any issues and concerns with your sexual activity?
No, ma'am.
All right. So now I'm just going to go through your whole body systems. I'm going to be asking you questions, and you just tell me if you have any concerns or if there's anything you want me to know about it, okay? So in general, how do you feel?
I feel pretty okay.
Pretty good. Do you have any fevers or chills?
No, ma'am.
What about any night sweats or fatigue?
No, ma'am.
No? All right, good. Any weight gain or weight loss?
No, for the most part, I'm pretty stable as far as weight.
Okay, what about your skin or your hair? Any lesions or wounds? Any abnormalities?
No, ma'am.
Any color changes, rashes?
No, ma'am.
Okay, what about your nails? Any concerns that you have? Any problems?
No, ma'am.
Okay. What about your head? Any problems with your head?
Besides my headache, no, nothing else.
No dizziness?
No, ma'am.
Have you ever had a concussion?
Possibly whenever I played football, but not from what I'm aware of.
Okay. And what about any brain injuries?
No, should be all there.
No fainting spells?
No.
All right. What about your neck? Do you have any neck pain?
No, ma'am.
What about stiffness?
No, ma'am.
Any lumps? Or even swollen glands?
No.
Okay. And your eyes? I know that you said that your headache is mainly behind the eyes, but have you noticed any problems with your eyes?
No.
Like blurry vision, maybe double vision?
No,
or
ma'am.
sensitivity to light change?
Well, the sensitivity to light, but other than that, no.
Now, the sensitivity to light, is that all day or?
No, that's maybe like a few hours out of the day I will be really sensitive to light.
And that's every day, or is that when
every other day?
Every other day? Does it happen when you have headaches, or it just occurs every other day?
It happens when I have headaches, for the most part.
Okay. And what about any dryness or maybe drainage from your eyes? Any swelling?
No, ma'am.
Do you wear any glasses or contacts?
No, ma'am.
What about your ears? Any hearing issues, any problems with that?
No, ma'am.
No deafness, no ringing in the ears?
No, ma'am.
No pain or drainage?
No, ma'am.
Okay, what about your nose? Do you have any congestion, any problems with your nose in general?
No, ma'am.
No congestion, no breathing issues?
No, ma'am.
No bleeding?
Nope.
What about your sense of smell?
It seems to be on point.
Okay. What about your throat? Any issues with swallowing or lumps?
No, ma'am.
Any dryness or hoarseness in your voice that you've noticed?
No, ma'am.
And your mouth? Any issues with chewing or swallowing?
No, ma'am.
What about your teeth? Any issues?
No, ma'am.
When was the last time you saw a dentist?
Possibly a few years ago.
A few years ago.
Just getting a checkup.
Okay. All right. Now we do have lymph nodes in the neck and head here.
Mm-hmm.
Any tenderness that you're aware of or swelling?
No, ma'am.
What about your breathing, your lungs? Any problems with your lungs?
No, ma'am.
So when you walk, do you feel like you get short of breath?
No, ma'am.
Can you lay down flat without feeling short of breath?
Yes, ma'am.
Okay. What about your chest? Do you have any, do you have any wheezing or coughing?
No.
Okay. And you're not coughing up any, are you coughing up any sputum?
No, ma'am.
All right. Any problems with your chest or breasts?
No, ma'am.
No tenderness or lumps?
No, ma'am.
Any discharge from your nipples?
No, ma'am.
Okay. And your heart, do you have any problems with your heart?
No, ma'am.
Any palpitations or fluttering that you feel?
No.
No? Okay. Have you noticed any swelling in your legs?
No, ma'am.
No high blood pressure?
No.
Do you feel like you can't tolerate your exercises?
No, for the most part I can.
Okay. Have you ever seen a heart doctor before or a cardiologist?
No, ma'am.
Okay. Now, do you have any problems with the circulation in your legs, or do you experience leg cramps?
Nope.
Okay. Have you had any blood transfusions in the past?
No, ma'am.
Have you ever had any blood clots or noticed that you're easy to bruise or to bleed?
No.
Okay. All right. Now, when was your last bowel movement?
Yesterday?
Yesterday. Any unusual occurrence with that? Let's say diarrhea or...
No, it was pretty normal.
Okay. What color was it?
Light brown.
Light brown. Was it soft?
Yeah, it was soft.
Was it formed?
Yes.
Okay. Any nausea or vomiting, constipation?
No, ma'am.
No dark or tarry stools?
No, ma'am.
Have you noticed any yellow color in your eyes or skin?
No, ma'am.
Any hemorrhoids?
No, ma'am.
Okay, and you said earlier that you eat out about 3 to 4 times a day. Now, do you normally eat a high salt diet?
Yes.
Have you thought about cutting back on that?
Yes.
Okay. And you said you had no food allergies?
No, ma'am.
Okay. Do you have any intolerance to heat or cold?
No, ma'am.
Any changes in facial hair that you've noticed or expressions?
No, ma'am.
Okay. Unexplained weight loss or weight gain?
No, ma'am.
Okay. And are you peeing okay? Any problems with your urinary tract?
Nope, it seems to be fine.
So you don't have a sense of urgency or maybe dribbling when you pee?
No.
Any blood in your urine?
No, ma'am.
Okay. Any hernias that you're aware of?
No, ma'am.
And no pain in that area? No flank pain or suprapubic pain?
No, ma'am.
What about any testicular pain or swelling?
No, ma'am.
Any penis or scrotum issues that you're aware of?
No.
Okay. What about your musculoskeletal system? Any joints that you're having issues with?
No. When I work out, I mean, I can't really feel anything out of the normal.
Okay. Any swelling in any of your joints
No.
Okay. And what about your range of motion? Is there anything that's restricted, like you can't do?
No. Feels pretty normal.
Okay. And I want to talk about neurologically. Have you noticed any dizziness or seizures?
No, ma'am.
Any weakness on one side or weakness in general?
No, ma'am.
Any paralysis of any body part?
Nope.
And what about your sense of coordination or even sensation?
No. It seems to be normal.
Okay. Now I just want to ask some questions about you and your mental health.
Okay.
Okay. You said earlier that you were feeling stressed at work.
Mm-hmm.
Can you describe that a little bit more in depth for me?
Just trying to meet the deadlines for the most part, and just that's pretty much it, other than just dealing with coworkers.
Have you ever felt depressed?
No, not really.
You said not really.
I mean, I'll get down every now and again, but that's just normal.
Okay. Do you ever feel like hurting yourself?
No, ma'am.
Have you noticed any mood changes?
No, ma'am.
Okay. Any difficulty concentrating lately?
No.
No? Okay. So in general, how would you say you are with your mental health?
10 out of 10. Okay.
Do you feel like you're tired or that you're sleeping all the time?
No. I typically get 7 to 8 hours of sleep in, and then I should be set for the rest of the day.
Okay. All right. Well, this concludes our health history. In the second portion, we will be doing the physical exam. And I just want to thank you, Mr. DW, for participating.